It doesn't matter how good the theory is, you need to get down to the field to check the implementation and to monitor the activities. That means you need to get to the road, you need to visit the sites, which are the villages, and see how things are going to be able to provide the legal evidence which will support the decision making.
Like so many countries, Tanzania faces a challenge and an opportunity when it comes to its young people.
For many years, Tanzania has been struggling with the burden of stunting. And the children in Tanzania, they are not developmentally on track.
Tanzania has more than 60 million people. Out of these 60 million, 1 out of 4 is under the age of 8. The data tells us only 47% of the children 2 to 5 years are developmental on track. If we invest in this young generation, we invest in the future generation of Tanzania.
To support Tanzania in tackling the challenges it faces, Thrive is collaborating with a consortium of researchers to fill important evidence gaps on early childhood development. They wanted to work with the government to understand why children are falling behind and whether interventions focused on parents might have the potential to turn this around. Researchers looked into why children are underdeveloped by looking at the parents.
The first question was this because they don't have the money to raise their children? The second question was, maybe they don't have enough parenting education, the caring education, or are there other things beyond those? And that's where now Thrive came in to support us with evidence that could be able to answer some of the questions we had.
Thrive collaborated with an ongoing randomized control trial called Kizazi Kijacho, meaning next generation, adding a specific focus on how to effectively scale the early childhood development interventions being tested. In the randomized control trial, over 3,000 families in the Dodoma region of Tanzania received different combinations of parenting support delivered by community health workers and cash transfers, starting in pregnancy.
We have 4 different arms into the randomized control trial. So we have the first arm with parenting intervention. So a group of parents that receives household visits and group sessions. And we have the second that received parenting intervention and unconditional cash transfer. And we have the third that received only unconditional cash transfer. And we have the fourth that receives nothing. So this is to help measure if parenting only has an impact, or we need parenting together with cash transfer, or cash transfer only has an impact on child development.
Thrive and their partners work closely with communities to monitor and understand not just what is working, but why it is working.
We are now leaving Dodoma City to Lugala village. We want to see how community health workers are providing education to the parents and also how data is being captured. And this is part of our usual monitoring process in this research program.
Advice on health, nutrition, safety, security, early learning stimulation, and responsive caregiving was delivered by community health workers, guided by a mobile phone app through home visits and group sessions.
Mafunzo niliyoyapata katika mzazi wa kizazi kijacho ni makuzi na malezi ya awali ya mtoto, ambao tulifundishwa jinsi ya kuwa michezo, kuwaelimisha kina mama kuhusu mambo ya lishe, pia na makuzi ya watoto ili wawe katika uimara katika ukuaji wao.
Parenting interventions that strengthened nurturing care have become central to global early childhood development strategies. However, there is limited evidence about their success in low and middle-income countries when implemented at scale through existing government systems.
So when we have results from the randomized control trial, it is not enough. So we need more information around what works better and how it works and for what cost.
On top of the randomized control trial, Thrive is looking at what it takes to design the intervention cost effectively and at scale.
We want to see how this research could be is implemented and how could be scaled. So we are looking at the process, about the feasibility, about the acceptance. We are also doing the costing for this study. How much would it cost if they have to scale up in the country?
We are implementing Kizazi Kijacho using the existing structures in Tanzania. Community health workers are already going into the community. We have trained them and capacitated them to integrate an early childhood development component into it, so that you don't have to hire a lot more people to implement the project. It can be used to scale up in the whole country in Tanzania to reach every child in Tanzania.
And so far, the results are encouraging. The nurturing care advice delivered by community health workers resulted in large gains in psychosocial caregiving practices and children's social-emotional development, even more so when caregivers received cash transfers.
Kuna mabadiliko makubwa kwa watoto, wanajua michezo ya tofauti tofauti, wanajifunza kupitia michezo tunawafundisha. Kwa kweli maendeleo ni makubwa sana kwa watoto wetu.
Mtoto wangu namuona yuko vizuri kutokana na mafunzo anayoyapata, yuko sharp, mjanja yani.
Transitioning to a financially sustainable government-led model of the program at scale will require adaptations, but the opportunity to make an impact which lasts for generations is clear.
Elimu tunayowapa sasa hivi watoto wetu, mbeleni watakuwa madaktari wetu, watakuwa wakurugenzi, watakuwa viongozi wetu wa aina mbalimbali ambao wataisaidia jamii katika kuwaongoza na kuwapa maarifa mazuri.
This research project shows not just what works, but why it works and how much it costs. It's one of many international projects carried out by Thrive to help find cost-effective ways to support early childhood development at scale.
Thrive is an international research program. It works in 5 countries, not just in Tanzania. So we take learning experience from other countries and combining what we are seeing in practice in Tanzania to bring the rigorous evidence which will help the government in terms of scaling up.
In Tanzania, for the early child development, we have the government right here, setting the guidelines and regulations and policies, and we have the implementers, the stakeholders at the ground where they're implementing. And right here into the middle, that's where we have now Thrive, providing the evidence around the policies, providing the evidence around the implementation part, but also providing the evidence around how we can reach these communities.
Change the beginning of the story, we change the whole story.
If you'd like to know more, please get in touch.